First of all, can you give us a brief self-introduction?
Yes, sure. So my name is Yannick Salanouba. I'm French, and I moved in Taiwan in 2008. So it's been already about 16 years.
So could you give us a little overview of your history with cardiovascular complications?
Actually, a couple of years after I moved to Taiwan, I started having some symptoms like short of breath when I was doing exercise at the gym, or when I was hiking, or when I would climb stairs. And so that started worrying me a little bit, because at the time I was, I was only I was less than 40 years old. So it was pretty young to have this kind of symptoms. So I decided to go to the hospital to do some examinations and start checking on this. Then after, different examinations, they found out that I had a heart condition, a problem with my valves that were not functioning properly.
Why did you choose Cheng Hsin General Hospital?
Some friends told me that Dr. Wei was very famous in Taiwan and specialized in this kind of surgery, and that Cheng Hsin Hospital had a service specialized with this. So I decided to get an appointment with Dr. Wei and to have a second opinion about how to do the surgery, how to do the procedure, and what was the best for me and in my condition. Dr. Wei was very open and would spend a lot of time giving me advice and explaining to me very clearly about what were my options and what kind of valve I could choose, and what kind of procedure was available, and give me all those suggestions, and then let me think about it. And that's what made me very confident in the relationship with Dr. Wei. He has this talent to make people feel very comfortable and reassure people. Dr. Wei made me feel very confident about the process and about how things would go and so on.
So what's the operation that you ended up going with?
So I ended up going with the open heart surgery with the bovine valve.
He had the bicuspid aortic valve, and he needed surgical replacement of the aortic valve. So we used the modern type of aortic valve prosthesis to replace this aortic valve.
So the operation went smoothly, I'm assuming?
Yes, the operation went very smoothly. I was not scared. I was very confident. I was doing the surgery thinking that I made the best choice in terms of hospital, and made the best choice in going through this with Dr. Wei. So I was very confident. I was not afraid. I was not scared. So things went very smoothly, yes.
Yeah, of course. Especially in the medical field, I think transparency like this is really important.
It's very important. When you're going to undergo a heavy surgery like this, you need to be very confident and trustful and have a connection with the surgeon who's going to do this procedure. I think it's very, very important.
So post-op, how did you find the inpatient process or the experience?
Very good. Actually, I was very surprised about how quickly I was able to recover. I was imagining, being in a lot of pain and not being able to move at all and so on. But actually, I was very surprised that the recovery went very well and was much quicker than what I expected, actually, because after the surgery, I went to the ICU. But after that, after just 2 or 3 days, I was already able to get out of my bed and start walking, which was very surprising to me. I thought it would be a much longer process and that it would take much longer time.
So over this recovery process, would you say that the facilities and services were satisfactory?
Yes, absolutely. I think the environment is very nice. The hospital staff also is really, really amazing in kindness, being there for you whenever you need it, in helping, and really, really a professional team helping you with, to deal with everything when it comes to recovery, but also